Oh, you're sliding in the first and you feel a little squirt. Diarrhea. Sitting in your Chevy and you're feeling kind of heavy. Diarrhea. Okay, I know it's not really funny. Diarrhea, though, a lot of people call loose stools diarrhea, but it's really not. Okay, what's happening in this condition is the lining of the colon has tiny goblet cells that are going to release salt, water, and mucus, lots of mucus. And if this happens faster than the colon can reabsorb them, we have diarrhea. It's effective for flushing out infectious diseases that may be trying to take up residency. They want to live in our colon. It's nice and warm and nutritious, but we take care of that. So when you do have diarrhea, just be at peace with it. You know, stay near a toilet, get some baby wipes perhaps, and some music, whatever, and just appreciate your colon for doing its job. Don't reach for those pills, at least not right away. Over time, if we have chronic diarrhea that's explosive and watery and it goes on for weeks, then perhaps we have nerve and muscle cell failure. And dehydration, anytime we're dehydrated, we're susceptible to infection and certainly heat exhaustion, because sweating is what keeps us cool. Food poisoning, sometimes people want to blame this on a 24-hour flu. They say, oh, I just had the flu. No, probably you ate something that had Pseudomonas, which is a type of protist, or maybe the bacteria Salmonella was coating the food. In reality, most of our food have some bacteria, and that's what the hydrochloric acid in our stomach is for, is to destroy them. But if we get a high dose, or if we eat lots of food at one time, like if you're ever at a picnic and you're not sure about the food, just eat little mouthfuls and then wait a few minutes, little mouthfuls, and that way they all end up getting burned up in the old acidic tank of your stomach. But if you eat and gorge yourself on lots of food all at once, then the bacteria can hide out. Okay, back to this. Acute means short term, and generally that's pretty safe because the body can destroy these organisms with diarrhea, for example. But if we have someone small, it's just like a pool of water heats up really fast in the sun. Same with a child. Their small body heats up really quickly with fever, and so it can become dangerous. In poor countries where they're already at risk for all sorts of diseases, or people that have suppressed immune function, like someone with AIDS, then food poisoning can become life-threatening. Obesity begins when we're children. Often by the age of 9, we've already formed much of the adipose that we're going to carry out through our life. And so we have all these chambers that can stretch and accommodate lots of fat. And so we want to keep those children active. Over time, a panniculus or omentum composed of a big apron of adipose starts to hang from the stomach. We can shrink the adipose cells, but we can't get rid of them without liposuction or some sort of procedure. Obesity may result in adipose storage in the greater omentum, and we call it central obesity. It's going to hang down from the stomach, and then we'll take a look at this diagram. I'm going to have on the lower right. Over time, what happens is some of the fat in our diet is going to end up in the liver, and the liver starts to change color. Okay, at first it's kind of a pinkish red, and then it becomes lighter in color over time. Now here's a nice review. So take a look at the video we have here. Good review of what we covered here. There's the stomach. There's the chyme. That's chyme coming down. And oh, what's the green stuff? That must be the common bile duct that's emptying bile salts into the duodenum, the first part. And then there are the micelles after emulsification moving back up in the liver for the liver to distribute. And okay, liver, gallbladders underneath. If you remember, the gallbladders are our body's way of storing large amounts. So if we have a big fatty meal, oh, looks like the liver is changing color. Not a good sign. Oh, there is the omentum, omentum, if I can get that right. And it's going to bulge over time. There it is. And some of the fat is going to flow. Okay, well there's feces there. And a little bit of Crohn's going on here. Yeah, good review. And maybe some diverticuli forming. Oh, this thing's looking kind of gross, so don't get too upset by this. There's the appendix down below, that little finger-like projection. So we must be in the cecum, first chamber. Okay, moving on. How do I have gas? Okay. Bulimia is a psychological disorder, and I am not a psychologist, so I'm just going to give you the basics. Symptoms are eating and purging. Purging means to get rid of what you just ate, either with vomiting or laxatives or both. One of the hazards, the medical hazards of bulimia is the chyme. We know now it's quite acidic, a pH of maybe 2 or 3. It's going to erode that tooth enamel, and you only have so much enamel. You don't continue to deposit. So tooth mass decreases, gums recede. Often the dentist is the one that first picks up on it, because the dentist looks at the teeth and sees tooth mass diminishing. In some cases, ulcers forming along the esophagus and in the oral cavity also occur. Anorexia nervosa, another one of those psychological disorders due to BDD, body dysmorphic disorder. That's when we focus unrealistically upon parts of our body that we're maybe not happy with. Maybe we have a little tummy. Big deal. Okay. We need a little bit of that extra weight to cushion our organs in case of we need that reservoir for some reason. So we don't want to go into this compulsive behavior that happens when they self-induce starvation. In this case, it can result in anemia, which is really kind of mild. It's just low red blood cell count. But over time, protein digestion, and I'm not just talking about muscles. I'm also talking about the enzymes that keep our bodies functioning. Right now, your body's at 98.6 temperature, and that's because of enzyme action. So it can kill. Just be aware. Anorexia can kill. Also osteoporosis, where the bone mass is reduced. We don't see kwashiorkor much in our country here, North America, but we see it in poor urban areas. And I say urban because on the farms, like say in Africa, I lived 2 years out in the bush. People in the villages do fine. They have their own gardens, but it's in the cities. They're drinking Pepsi Cola and eating white bread. And it's not marasmus, which is just protein deficiency. This is a certain type of dietary deficiency called kwashiorkor, where we get that fatty liver disease and the swollen abdomen. So they might be eating enough. They got lots of white bread and donuts, but they're not obtaining the protein that they require. Gallstones. This is formed in the gallbladder when the body mixes cholesterol from the diet with bile salts, and that's a normal process to form bile that helps us emulsify our food. But if that bile cholesterol balance is off, meaning too much of one product is in there, then we get this sludge. We get a thickened, gooey, chunky mess that form these little stones, and some of them can be quite large and large enough to block the common bile duct. And if that happens, it's very painful. And if the gallstone is not removed or passed, then it may require a removal of the gallbladder. Appendicitis. In the appendix, if you remember the colon, it's that little finger-like projection. And what happens is sometimes it doesn't receive enough blood. And that could be because the stool, as I mentioned, if the passage of the stool is very slow and there's not a lot of fiber in the diet, and so the blood to the appendix can be cut off. And so sometimes bearing down, like people with constipation. But whatever the cause, then the appendix may burst, and now we have coliform bacteria. So I'm thinking E. coli and other fecal bacteria, and so we have something called peritonitis. We can use open surgery, which is done to exploratory. Let's say maybe the liver's damaged too. We want to take a look, or laparoscopy. And if you take a look here on the lower right, you'll see healthy tissue has a pinkish. There's healthy pink. A lot of blood vessels there. Now the surgeon is lifting up. There's the appendix, and you see it's not supposed to be that color. It's well, there it is. He's revealing, or he, she, or whoever is revealing that darkened area. So something's happened. We have some blood cell death, and that finger-like projection should be a lighter color, almost whitish. And so the choice here is you can give them antibiotics, but if you're already in there, you've already made an incision, it might be best just to take care of the problem right there and then. Review here: GERD, gastroesophageal reflux disorder. Think of that LES. A proton pump inhibitor is going to cut down HCl. Constipation, not something caused by one factor, may lead to hemorrhoids. Diverticulous is itis. Think of the inflammation in those little pockets. Colon cancer, colorectal we call it. We want to remove those polyps before they become malignant. Crohn's, that inflammatory bowel disorder that influences the colon. Peptic ulcer, caused by some inflammatory agent, maybe Helicobacter. Diarrhea, goblet cells are releasing so much mucus, there's so much salt and water that we flush those bad guys like E. coli and Giardia, Salmonella, Pseudomonas, kick them out. Gingivitis, inflammation around the gingiva, the gum tissues, may lead to periodontal disease. Food poisoning, I mentioned these guys. Obesity, which involves adipose tissue and may lead to fatty liver. Bulimia, binge and purge, eat lots and then get rid of it. It may affect the oral cavity, throat, teeth. Anorexia nervosa, self-induced starvation. Kwashiorkor, protein deficiency. Gallstones, we have bile and we have cholesterol forming these stones. And appendicitis, itis, inflammation, something's inflamed. The lower right quadrant has this rebound pain. That's as if you push down, hey, it feels fine. So you use your hand and you palpate that lower right quadrant, hey, they're doing good. And then when you let off the pressure, oh, that's called rebound pain. If those coliform guys get loose, we have peritonitis and a severe condition. Amazing. Most of the time our body works just perfectly.